Hi, my name is Dr. Cynthia Berry, and I'm with Berry Organizational and Leadership Development. And today I will be presenting the data and research that I've been collecting over the past 18 to 20 months on the impact of COVID-19 and the pandemic on our mental and behavioral health needs of students and youth in our local population. So what I've been doing is basically collecting a whole bunch of information from a variety of sources. Some of those school staff are counselors, superintendents, principals, assistant principals, et cetera. And then also throughout the last 18, 20 months, we've been collecting data from our program staff, specifically a lot of our not-for-profits that respond to the mental and behavioral health needs of students and youth, specifically in Lincoln County. And so I'm going to share that information, the progression of that information throughout the pandemic, and hopefully at the end showcase some of the positive aspects and potential recommendations of what we can do since this pandemic is still occurring as of today, which is September in 2021. So I'm going to go ahead and share my screen. And so today, like I said, I'm going to share the local source data, and we're going to dive right into the initial source information that I collected. And so typically twice a year, I work with Lincoln County Resource Board to gather feedback from school staff on the needs of students with their behavioral and mental health. And what we do typically is present this information to encourage and promote communication between our school districts and those funded partners through Lincoln County Resource Board, so that adjustments can be made to their curriculum and or their services that they currently provide. And so we've had 4 different data periods through the pandemic, and you're going to see the progression of some of that data and how this impacted our youth throughout the pandemic period. And then, like I said, the goal is to potentially have programs get modified or enhanced and or identify additional or expanded services that agencies could provide to those students and youth in Lincoln County. And so one of the very first things that I want to point out has to do with one of the questions we ask, which is for staff to identify the top 5 most critical behavioral and mental health issues they believe youth are experiencing or encountering when they're trying to resolve those issues or when they're seeking help for those issues. And so you're going to see a lot of this information I'm going to make available to you. The report can be something that you can gather from me or the contact person through the community summit. And so anything that I don't physically say today, you'll be able to access that information. And so you're going to see the top 5 issues that came out in May 2020. And this is in narrative format, but I'm going to actually bring up the table information, because when I present this data, let me just kind of make my little self a little smaller or move that. You're going to see the difference between basically the 5 top critical issues, mental health issues in 2019. So this would have been collected in December of 2019. So no COVID, no pandemic. And then you're going to see those top 5 issues that emerged right at the very beginning of that pandemic. And so when we look at 2019, we see one of the highest issues were friend-peer relationships, social skills, problem solving, and self-esteem. This was noted by 28 of those counselor staff, superintendents, principals, high-level staff that really know more about the mental and behavioral health issues. So 88% for that issue. Anxiety and worry is at 75%. Controlling emotions, anger management, conflict resolution, identified by 72% of those staff, self-harm and suicide by 59%, and depression, sad a lot, at 47%. And so when we move to the May of 2020 period, so approximately 2 months into that period of time when students were sent home and in 100% quarantine, nobody was leaving their home, we see that anxiety, worry a lot, and fear became the most prominent mental health issue for our staff, followed by friend-peer relationships. So that still stayed high. Controlling emotions, again, still at the top, but higher percentage of our staff were presenting that information. And then we actually see a pretty significant increase in the percentage of students that they felt were dealing or coping with grief, loss, and or divorce at 56% in comparison to our 38% over here. And then feelings of acceptance and belonging. So really not knowing where they're at. And then you can see some of our other issues as well that were presented. When we asked about other responses for that May 2020 period, we actually saw adult mental health concerns and instability that came from a couple staff members, and drug use, alcohol use, and abuse potentially at the parent level as well. So the next question, we gave them that same list that you just saw in the previous table. And we asked if they felt that those issues were increasing for students, staying the same, or decreasing. And I also threw out the prompt of, did they know? And so counselors are typically able to interact with students, on a daily basis when they're coming into the physical building. That's something that they're able to see, the verbal and nonverbal cues, but just the way, students look, being able to talk to them, etc. So it was expected that there were going to be staff that did not know this information or had limited access. And this was supported in that out of 16 possible BHMH issues, more than 50% of staff reported that they did not know about 10 of those issues. And that included some of our riskier things like abuse, suicide, self-harm, housing instability, and also drug use. We also experienced that 9 BHMH issues had more than 10% of school staff rate them as increasing trends since COVID-19 began. And so what are those increases found in? We saw there was a 75% increase in food and basic needs insecurity, 63% expected an increase in anxiety, 50% depression, being sad a lot, 33% for both friend-peer relationships and also controlling emotions, 21% increase in coping with grief, loss, and or divorce. And at this period of time, there weren't a lot of, say family members or a lot of news about hospitalizations and deaths, things like that, although that did happen as the pandemic progressed. But loss, general loss of just time, general loss of seeing students, all of the things that they missed out on, cancellations, prom, to friend events, activities, sports, all of those things. Just general sense of loss was very high at this period of time and continued really throughout the pandemic. We do then have some emerging issues with housing instability, abuse and neglect, and then also self-harm and suicide. And a couple of those staff members just mentioned, they're concerned about abuse and neglect of students, online safety, and mental health, but they aren't aware of those specific situations because they lack that contact. They're also concerned about the abuse and neglect cases. This came from another staff member, again, online safety, but again, limited. And family conflict was seen at higher levels. And again, that sense of disconnect from peers and lack of motivation, which continues also throughout the pandemic. And then you'll see here, I've given the table that you can see the number and also percent for each of those items that I just covered, in addition to the percentage of those that responded that they don't know or haven't heard. I know some of you like to see those things in narrative format and others like to see that in table format. So this will be available to you as well. Okay, so we also just had a general question, how has COVID impacted the mental and behavioral health needs of your students? And in general, they felt lack of communication and knowing if the students that they consider higher risk are doing okay. And many of the staff noted that they are not at all or were not at all hearing from parents. So they really couldn't assess what, if any, changes were occurring in the home environment or with students. And at that time, the recommendation was for these stakeholders, including school districts and providers, to identify strategies that increase ways for youth to communicate with others outside of their home and also on a more regular basis, so that there are at least touch points with that student. And so I can tell you some of the not-for-profits I worked with was looking at, let's say, a prevention program. That prevention program typically was going to be on site at the school. And that would be when you access information, let's say on disclosures or drug use, things like that. And so not having that ability to do that, a lot of quick thinking happened over the summer of 2020 into the school year 2021, so that students would still receive programming and or services, and also have other ways to potentially let school officials or even the agencies that they're working with know that there are issues at home. I know a lot of the not-for-profits that are in Lincoln and St. Charles County also modified their service delivery, and I'm going to share some of that information with you later on in the presentation. And because I really want to make sure the voice is shared, these staff members really provided some interesting comments and comments that took even me back with what was going on. And so I've given some of those comments into this report so that you can kind of see those and have it be their voice. And so that really goes on and on. A couple things here: just increase in sadness from seeing friends and anger towards parents, acting out, just again, isolating more at home. Some parents were requesting food assistance, referrals, etc. That was some of the comments we received at the elementary level. Middle school staff were basically saying, at the time, I'm worried because I haven't heard from some of these students, and just the newness of everything. Again, not sure of what's going on with the impact of COVID. And then in high school at the time, some were saying, hey, I'm hearing people are doing okay, but there were increases in feelings of depression, isolation, and family conflict. And at the time, the worry really among the school staff was about those students that they weren't hearing from at all. So this required a very different approach, since the students weren't going to be coming to the school setting or any kind of sports activity or other activity for other adults or mentors to be able to, help them. Okay. So then now we're moving into the next data period. So I just kind of showcase some of that data available in May 2020, and now we're in December 2020. And again, we asked actually for some of this information to be divided between their viewpoint of the virtual learners and then those in-person learners. So they were again given that list. And at the time, the counselors then were going to be able to interact more so with those students that came into the physical building. And so it was expected that those that were still at home were going to have limited knowledge or just lack of information on what was going on. And so this was supported in that out of the 16 possible BHMH issues, more than 50% of staff reported that they did not know about 8 of the issues for virtual learners, and only 1 issue that they didn't know about for in-person learners. And this included some of those riskier behaviors again, abuse and neglect, suicide, self-harm, housing instability, bullying, more so actually with the virtual learners, cyberbullying, and then also drug use. So let's first look at some of the responses and changing trends for our virtual learners. So 10 out of the 15 BHMH issues had more than 10% of school staff rate them as increasing. At that time, the number one increased issue was anxiety, worry, and fear. So 69% of the staff said that had increased. Depression sat a lot, and some of the peer relationship issues or social skill issues. And then we also saw more increases or perception of increases for coping with grief, loss, and or divorce, controlling emotions, feelings of acceptance and belonging, self-harm and suicide. We're also then seeing food and basic needs insecurity. Think about a lot of the changes in employment that have occurred, and then also abuse, neglect, and housing instability. So then moving into the in-person learners, we actually then had a higher percent of staff saying they saw increases, and these were things that they could actually see with those students that are coming on site, increase in anxiety, worry a lot, fear, depression sat a lot, was at 63% increase. And then controlling emotions, anger management, and conflict resolution. So that was noted among a lot of school staff and also the not-for-profits, just the ability of youth to kind of handle what's going on and be able to talk about what's going on and share that, just general loss. Adults struggle with sharing that information. And so students and youth were struggling with that as well. And then you can see the rest of the list here where, a lot of these issues for those school staff, so they were basically remarking that there was an increase in these issues over time for those in-person learners. The only issue that staff noted as a decrease during the pandemic was bullying and cyberbullying. And actually, I heard that a lot as well, that some of the students that chose virtual or did stay home they were not on the receiving end of bullying, and or they weren't worried as much about bullying because they were not obviously seeing that bully face to face. And then again, for those of you that love tables, you're going to see the differences between our virtual and our in-person learners. And like I said, there's going to be a higher percent of the staff when they rate virtual learners that still don't know. And then notice over here, there is a lot less of the staff that don't know about the in-person learners. So I thought that was really important to showcase in this table. So we then again asked, how has COVID impacted the mental and behavioral health needs of your students? And the primary theme that emerged was an increase in stress and anxiety among students, including just this general fear of COVID. And that really was present earlier on in the pandemic and the school year. A couple of the elementary staff noticed that there had been heightened stress and anxiety among parents and also students' home life, and the probable significant impact to students on the home front. Another staff member noted just that they had seen an increase in students just wanting general attention, not necessarily positive or negative, just attention in general. And so that's an interesting finding. And also a couple staff said, early on in the year, there was heightened fear for our students, but yet by December 2020 data collection period, that had dissipated. So, you come back, clearly from the summer, the activities parents and families were engaging in, and that as time progressed, some normal life went back, especially for those in-person learners. It was noted that younger students really struggled with structure in the beginning of the year, since that had been lost since March of 2020. And also, being with parents, mom and or dad for such a long time at home, not necessarily having that school structure, again, especially for those in-person learners. Among our middle school staff, they noted that there was increases in anxiety, stress, and especially economic stress. And a lot of families did deal with that over time, and in fact, are still dealing with that today. And so that prompted, an increase in some of the depression and depressive symptoms. Some teachers just expressed that there had just been a generalized increase in mental and behavioral health needs of their students. They did mention that virtual students were struggling academically, and it really started to be noticed at this period of time. And specifically, middle school students were tuning out teachers during lessons. This really was prevalent for our virtual learners. The high school staff experiences were similar to the middle and elementary. And one staff member commented that this has, without a doubt, been the most challenging mental health year we have had thus far. And that is such a powerful statement. These staff members, these counselors, these principals, they have dealt with a lot in their days. And so to remark that that particular year, it was the most challenging, just shows how much more we support services, ideas outside of the box, groups to be formed for before and after school, anything we can do to help students have more of an outlet and to be able to kind of talk through these issues so that we can get back to some, regular feelings when the pandemic subsides. We're still seeing anxiety and depression, and really a lot of the high school staff just, emphasizing the need for coping skills. Coping skills is something that can be taught at home. I have a lot of tools, just, simple tools on what do you do when you're not feeling great? What do you do to cope with anxiety or just, again, sadness? And any parent, any person out there that is taking care of children can access and utilize coping skills and coping resources. So reach out if you need something like that to put in the home front, or if you're an agency or some kind of service that, helps youth, have these things available to you quickly to get to parents and to students. Any means of services or resources to help these youth, again, because this is more of a generalized issue, whereas, normally 10 to 12% of our student population has serious emotional disorders or an official mental health diagnosis. With the pandemic, it's more generalized sense of anxiety, sadness, depression, etc. Okay. So again, just more data here, loss in personal connections. And as the pandemic continued, virtual learners began to struggle and continue to struggle. And the more they struggled, the more likely they would also have anxiety increase. And it became somewhat of an ugly cycle for some of these students. And I'm going to share some of that data with you later. But overall, the impact really was widespread. It didn't just hit one group. And while we can say, oh, the virtual learners definitely got hit harder, and that is true to some of these examples that I'm presenting, the fears, the loss, the isolation did impact every single human being. It's just at what point did some of our students and our youth go back to some sense of normalcy? So then we also kind of wanted to ask some questions really about just the quarantining aspect of the pandemic. So for your virtual students and our students who are temporarily placed in quarantine, are you experiencing any levels of disengagement from the student as it relates to logging in at appropriate times, completing assignments, and just general engagement with school learning? And overall, the staff responded to an increase in disengagement among students when learning virtually, and definitely included quarantined periods. Some staff noticed the home environment was not as supportive as it should be or could be. And in some cases, this may have been due to technology. Others, it may be due to just lack of parent and or adult involvement. As the grades progressed, those students were less likely to regularly log in and complete assignments unless they had that parent support at home. And then that period of quarantine, they were falling behind, which, you missed 10 days of school as a middle school student or high school student. Coming back and catching up is not very easy. And then a variety of school staff remarked at the individual differences in students being consistent as either virtual or in-person learner. For example, a student that did poorly in person tended to continue that habit at home. It just maybe became a little worse. And so that might be a prompt for how or when to offer additional support or intervention. An A student, maybe the intervention or support is modified. Maybe it's not as much as, say, a C or D student. And perhaps there might be other ideas for how to quarantine besides just sending a student home if that home environment is not supportive of learning or academic achievement. Okay, another question we ask is just, general barriers that they see students encounter when trying to address a BH need, a behavioral health need. And so this period of time, this data collection period, I asked them to rate this separately for in-person versus virtual learners. And for the most part, they line up. The number one barrier across both is just lack of parent involvement to assist student with the need. And so, traditionally we think of sending resources home to parents or emailing parents. And this would tell you that we need to make sure we're directly emailing and providing resources to our students. And mind you, I have a middle school student. Email still is something that he doesn't check on a regular basis. He's moving into high school this year. And so that's something that he needs to do more. And I need to support him in doing that. So it may be that schools have to provide things in paper to those students and or send it home via mail for that student to have access to this. So at the time, recommendations basically came out that any of our stakeholders focused on BH and MH issues, including our school districts and providers, need to identify ways, more strategies to increase how they communicate with youth. And this needs to be outside of the home and on a more regular basis. So where do you communicate? Let's say it's, online, gaming, Snapchat, whatever. Let's think outside of the box and maybe come up with ways for peers to also communicate with other peers. So like peer leaders, those that really feel that they have a handle on this, to be able to provide other peers with, supports, coping skills. What do I do when I have this issue? They listen more to peers than they do other sources at the time, especially as they transition into that middle school and high school arena. And then, we had to, and everybody had to stay on top of satisfying educational needs because some of these might go unnoticed. So asking your student, what else can I do to support you? Or do you know how to do this? And actually showing them or having, videos that show them how to stay on top of some of their academic paths and be able to maintain their academic goals so they don't have BH and MH issues result from academic issues. Okay, we again just had a couple open-ended questions. We wanted to really just identify in May 2021 some similar issues and questions that you've seen in the past. But we did ask a couple of academic focused questions on the data collection period in May 2021. And so this comes full circle with that staff survey. So by May 2021, the impact really resulted in the primary theme for anxiety and worry, depression, anger at this point, and continued feelings of isolation experienced among students. And again, this was expressed by many staff across many grade levels. You'll notice though, at this data point, a lot of the initial fear of COVID had dissipated. So the fear piece was not there anymore. The anger, sadness, again, depression. Many staff noted that they really needed more counseling services for students, especially within school and also via telehealth, because that was an option that really just a huge benefit overall, not just within mental and behavioral health, but physical health in general. Having the telehealth piece come out of this, where parents and students can get support for their needs when they're at home, has just been a huge development. And this should not end when the pandemic ends. So we noted, or I just noted, that COVID fear had dissipated, more counseling services were needed. The private schools remarked on increases in anxiety and anger, but they also mentioned a lot of their kids were really resilient. A lot of things kind of were thrown that student's way, and that by May of 2021, we started to see some happiness again. And a lot of the private schools did continue to have school in person all of the last school year. And so perhaps by the end of the year, again, some normalcy. There maybe weren't as many public or social events, but they still were able to see their peers and friends in the school environment. And we also had a lot of continued sports and outside activities resume. And so again, students felt very good and youth felt very good about this continuing. But in general, 2020-2021 school year, there was a noticeable loss in social interactions. I think about just the lunch environment and students needing to have assigned seats all year. A middle school student then is going to pick the people she knows or he knows in the beginning of the school year and not necessarily decide to sit by someone new and to build and develop those friendships. And so this should not be unnoticed, or this issue shouldn't be just, kind of dropped from here. I would say if we can promote some type of development or program within the school environment where students can try to still form new friendships, let's do that. I know the contract tracing is a big deal, but we need to somehow look at the relationship development phase, especially among our middle school and our high school students and those transitioning grades, to allow for them to interact with students and new students to form friendships. Okay. Within these questions, I really wanted to provide some of those comments again that came right from school staff. I'm a big proponent of qualitative feedback. And while I'm giving you general themes many times, it just doesn't resonate like some of these quotes do. And so, you can just see that, for many of our students, being out of a routine and a safe environment caused them to slide on progress they've been making with both mental and behavioral health concerns. We have seen an increased need for connections and for their personal needs, including some aspect of all areas of concern for teenage mental and behavioral needs. So take the time to read through these staff comments. Other mental health challenges as a result of being quarantined, not a lot of new information here, but we saw just, again, anxiety and stress due to getting behind, depression, sadness, and anger, and grief because they had missed out repeatedly. So by this period of time, this has happened, the disappointment, something got scheduled and now it has to be canceled. This just had a huge impact and just kept happening. So that fear of missing out was really present in May of 2021. And I think back to just earlier parts of the summer, going to Old Navy and seeing the masks half off or $1 and looking at that rack and thinking, this is ending. And here we are, we're right back to wearing masks for a lot of our kiddos in the school environment. And so here again, I've provided you some of those comments to take the time to read through. You can pause this and take that time as I showcase them. And I know you all are able to read, so I'm not gonna read that to you over this recording. So this is the first time we actually asked them to identify the impact on academic paths and or educational needs of students. And so when we asked that, many of them commented on the educational lag, especially with virtual students. Many high school staff remarked on the lacking interest of students in applying to colleges and for student loans, with many of them lacking enough credits to even graduate last year. Troy staff even mentioned having to implement a new format for credit recovery due to the number of students that had failed or were failing core classes. So again, thinking out of the box, doing something different. We need to do this across the board. And among the schools who were in person most of the year, their staff noticed that it was still too early to gauge the long-term impact and or that initial loss was minimized as the year progressed. So it's almost like we have, again, two pockets of students. Some of them were able to get back on track and the virtual were clearly lagging at some point. And so once again, I'm going to pull up some of these comments for you to pause and take the time to read. And to make sure you see the rest. And just this last comment, yes, this has caused our students to miss out on social engagement and rob them of a feeling of connectedness all youth need. And that is such a crucial time in students' lives to have that social engagement happen. And then other academic challenges relating to just being quarantined, noted that the students struggled to keep up with assignments, general disengagement across the board from both students and parents, and the limited support on the home front were really creating negative effects for students. In some cases, those limitations were due to technology and internet services, and others had to do with just limited knowledge among students on how to complete these things. So you have a student that's been in person all year and now they go home. How do they use these online systems, submitting assignments, dealing with kind of work the way adults do, emailing, following up. Students don't necessarily have that skill set. And if they weren't getting that skill set from parents, they weren't getting it from school, it was just a general lack. So this really became a big issue for a lot of those students just sent home quickly with that limited support on the home front. And so these are some of those staff quotes that really talk about the perspective of those school staff. And so I'll just read one here. Our virtual learners had substantially more failing grades than are in person. Many would not log into live instruction or office hours at all. One student who returned to in-person learning this semester had no idea how to submit a lesson to Canvas, the sole platform she was expected to use the entire fall semester. Students who are typically AB dropped to CD. Students who were CD dropped to F. And it is rare a 14-year-old who has the self-discipline to learn exclusively online without any supervision or in-person instruction. And so our expectations were probably a little too high. And I know a lot of us were just jumping into, what can we do to help these kids? And this was the result. So knowing and understanding, a lot of these kids wanted to do well. It's just they were faced with so many issues. They didn't know how to, respond and move forward. Okay. So at this time, I'm actually going to stop the video for part one, because some of you may only want to look at and read through the school staff survey component. And then I'm going to make available the second video as well, which will be focused solely on the feedback from our not-for-profit agencies. So please come back for part two. And I appreciate your time going through part one. And I should see you in a little bit. Hi, this is Dr. Cynthia Berry, and I'm here to present part two on the impact of COVID-19 on the mental health of youth, specifically in our local community with our data source, again, coming from Lincoln County agencies, those that are funded by the Lincoln County Resource Board, and many of those agencies that do provide services relating to the mental and behavioral health of students and youth. That do that in Lincoln County provide a lot of those same services to St. Charles County, Franklin County, and even somewhat St. Louis County and beyond. So I divided this up into two parts, with the first part being solely about the data that I received from school staff, specifically our principals, superintendents, counselors, and individuals that are really, deal intimately more with mental and behavioral health of the students. And I have part two then being solely focus on the data I've collected from the agencies that provide services. So I'm going to dive right into that information. And you're going to see, obviously, this is our first highlighted page. And I mentioned a lot of these things in part one. And so we're going to dive into part two. And that's going to start where you're going to see some of this yellow highlighting. And you'll notice that with part one from the school staff that I did a lot more analyses, data summaries and things like that. And I haven't taken that approach with our not-for-profit agencies that provide these services, because they're also unique in the things that they do. I didn't want to basically just hone in on just some surface level information. And I really wanted to make sure that I provide people out there that want to know what individual agencies and or programs did to resolve and respond to the COVID-19 pandemic and the constant changes and how that affected our youth. So similar to the questions that I ask our school staff, we also asked the agencies about the impact of COVID-19 on the mental and behavioral health. And my first data source actually started in the summer of 2020. And a lot of that information we asked about how basically services would potentially be modified and or other protocol that they might put in place. And so I think a lot of that information is going to be very valuable to many of you that respond and reach students and youth. So We're first going to look at this comments that I provided. And like I said, they're not going to be, just summarized. You're going to be able to see the full narrative for that information. And so these quotes basically, or these sections that I've highlighted, are really what spoke and resonated with me. And then I'm giving you the agency and the program that provided that comment. So looking at our violence prevention programming from Compass Health Network, specifically, they noted that this was a major impact, significant impact on communities, children, parents, teachers, staff. So pretty much named everyone. And at that time, being summer 2020, everyone was hopeful for that return to school and that normalcy and structure would potentially resume. We know that that did not happen across the board, but at the time they were going to do their best to respond. And so again, the Pinocchio program, which really responds to some of those issues present in our younger students to kind of identify potentially problematic behaviors or just behaviors early on in that development phase and provide those services to those students so that there's a long-term impact there. They noted again that this really impacted everyone and the disruption to young people's lives and that routine. And, you think a lot of these Pinocchio services reach, 5, 7-year-old, 8-year-olds. This last year and a half has been a significant chunk of their lives. So impact is very different. And that, school setting, they remarked basically is what is that safety and security net for many students, not all, but many. And that abrupt change really caused some stress, not only for the students, but also parents alike. And again, that came from Compass Health Network. They also provide the partnership with families and school-based mental health programs. So those are two separate programs, but they kind of resolve the same type of issues. One's more external to the school environment, and then the school-based mental health is within the school setting. And so again, they commented on that lack of school routine, the schedule, and really then those supports that a lot of kids rely on. And not only the school-based supports, but you think nutrition services, the food, backpacks, all of those things. And so families then dealt with increased anxiety. A lot of unknown happened. And then we saw some major employment changes, and financial issues really just became very prevalent for many families. Every family, I remember how it impacted us, not knowing what would happen to my husband's job or even some of the projects that I'm working on. What does that look like moving forward? So they also commented on higher rates of internal conflict, frustrations, and then less social interaction. And that caused a lot of emotional dysregulation among our youth population. So FACT is also they aligned with Compass to provide that partnership with families, and they are a little bit of a different connection to those families, and just kind of helping to navigate services that will be required for that family and help them kind of guide them through that process. And so they noted, just the increased need for a lot of resources, and also the just transition. So they really focus on providing help with the transitions for, online school, telehealth changes, how to use all these different applications, communication changes with providers, and then having the various resources to meet the demands of school and even psychiatric care providers. And all of those things, again, were struggles for many of these agencies, but these are the people that are just great at what they do. So they immediately put a lot of these things in place. And I can't speak, more about how neat and great it was to see what these not-for-profits were able to do, especially as things changed. They put things in place to continue to provide those services. So Nurses for Newborns, again, a different type of service. They really saw that the isolation of many of their families, and so therefore additional support, referrals, and resources were needed. They then leaned more towards dropping items off and potentially having nurses see families, but in maybe a different type of way. And so that they were able to continue to provide for those needs and requests. Our preferred family health care, this outpatient substance abuse program, at the time when this was still provided, they had seen an increase in substance use among the youth they served, and that the youth that they had previously, resolved substance issues, had relapse, and that was due to just ongoing anxiety and feelings of isolation. Preferred also noted with their Team of Concern program, again, the isolation and stress continuation. And so overall, if I were to say any, major change that as a whole or as a community we can make is that every single individual that has contact with youth should provide and know how to provide just basic coping skills, coping mechanisms. And this can be as simple as, getting a list with your child. What do they like to do? What makes them feel better? What are things that they can get involved in that they don't have to think about the stress and anxiety as much, and help them when they're having those moments of just struggle and guide them towards those coping mechanisms. There are even some great apps out there that kids can put on their phone to help with these things as well. So the Presbyterian Children's Homes and Services organization provides therapeutic mentoring. And so the comment that I pulled out of this one is just the note that their note about parents being so stressed, especially during those periods of quarantine. I can relate to that when, my children were quarantined, how much that just disrupted what we were needing to do at the home front, and just also the support for my child with school. So I'm sure that was felt across the board. And in many occasions, I would have to kind of change my day-to-day to be able to be present for my child so that they would not struggle. One of my children is, that straight A type student. And so I really saw him personally struggle with these types of issues, and he doesn't ever struggle. And so really throughout a lot of this data, I saw that play out too, just an overall generalized sense of anxiety and stress among just the general population. So here, clients who have a moderate to high level of parent-child conflict, that really was more present, and then had trouble regulating their emotions, being anxious and stressed. So over and over, you're seeing anxiety, stress, anxiety, stress. St. Louis Counseling provides office-based counseling services. They also provide school-based. So their notes are somewhat similar, but I want to present them because it's a little bit different. So they immediately transitioned to telehealth. And they reported that children and youth, again, had increased anxiety and depression, and really more observable behaviors relating to trauma. So some youth then reported they did not even feel comfortable speaking confidentially in a virtual environment due to people that maybe were in their home environment and or that lack of privacy. So it just potentially impacted some of that therapy or that telehealth component. So a recommendation here is if you have a child or even yourself are engaging in telehealth, make sure that's done in a private setting so you really can have that, the ability to just share and talk freely about what's going on to get that help. So like I said, they do school-based as well. And they noted that many of those students, again, higher levels of anxiety and depression and poor coping skills. And again, just the time period for this is summer 2020. So there's still a lot of unknown. And that they even noticed that students were having a harder time concentrating, even just staying focused. And so that does impact that emotional health and then also that academic success or lack thereof, right? We are fortunate also to have St. Louis Counseling provide outpatient psychiatric services. And again, they noted with this group, they're less optimistic, more anxiety and depression again, and that there were actually significant increases in missed appointments for psychiatry. And so in some of their speculation, it may have been due to their ability or lack thereof, again, to pay for medications. Some of those barriers to telehealth, which could be, across the board from that lack of privacy to potential costs, technology issues, and then families' inability to kind of maintain that level of care across the board. Again, if parents are struggling and children are struggling and across many of these different facets of life, that's going to create a lot more instability in the day-to-day home environment. So this kind of crosses across 2 pages, and this is the St. Louis Crisis Nursery. And so this is our respite services. Great service, when families feel just, overwhelmed and need support, maybe even they're feeling that their heightened mental health might, harm their child or, just create somewhat of an unsafe home environment based on their, perception, they provide respite services. So under-resourced families then were really struggling to adapt to that constant change and all of the other, things that can kind of happen with your unemployment, loss of income, making sure they actually have basic necessities covered. The fear component of this virus, somewhat driven by the information we receive via news, but also driven by just what you're seeing with, real life people, loss, deaths of family members, just seeing those kinds of things on a regular basis, and just that fear piece. So then again, child abuse and neglect prevention services really were critical. And this isn't the only agency that responds to child abuse and neglect. So we're going to see that impact a little bit later. But then the risk factors for abuse, social isolation, lack of supports, poverty, high stress, really increased significantly for many of these families, and they just didn't know what to do. So when everything shut down, there was a lot of that, shelter in place. And so there was a more vulnerability for those youth. And at that time, the child abuse hotline reports actually decreased, and concerns of increased family violence were growing, but not necessarily known. And this in part had to do a lot with, the mandated reporter component are many of those people, those adults that have access to kids. And so that access really was taken away. And so thus the decrease in hotline calls. So St. Joe Command Care Service is somewhat of a wraparound type of service within their child and family development program. I've had the privilege of working with them for many years. I think about a 7-year period of time up through, I want to say maybe 2012, and really helped with some of those program pieces. And so it impacted their program and their clients in a variety of ways, from just basic support, again, to issues, mental health issues such as anxiety, in a population that already worries about where they're going to sleep. So this is a very vulnerable population that they were able to continue to serve, just not necessarily in that original or traditional way. So this one comes from the Child Center, and they provided a lot of details about what had happened with the child abuse and neglect component throughout the pandemic. And I do want to take some time to kind of read through this in particular. So, they know thousands of children then dealt with heightened risk of abuse and neglect. And the mandated reporter component really had that limited interaction. So then things like physical abuse, sexual abuse and neglect, children just being in their home environment, posting photos or filming themselves, and even in some cases doing live stream and things not being appropriate. So despite all that, though, the hotlines in the state did decrease this has been May of 2020 in comparison to May of 2019. And that decrease in hotline calls was about 37%. So they did see isolation, and that was definitely detrimental to children being mistreated. And so the Child Center then did continue to provide essential crisis intervention services. They were basically deemed an essential service, one that had to keep being provided. And yet they also remarked about some of their most severe cases that they'd ever experienced during this time. And so one of those cases, or there's actually a few here that I really want to make sure to share. So all unknown information, we don't have any names here, but there was a little boy who was so severely abused during the stay-at-home quarantine period that he dressed in as many layers of clothing as he could find to keep warm, and then went into the woods to sleep because he knew that he needed to get help, but he couldn't get help then, and he'd have to wait till the next morning. Another middle school student was so desperate for help, she actually emailed her entire school detailing her abuse. And a 12-year-old who was actually referred for a forensic interview, but he couldn't visit the Child Center for several weeks due to lack of cooperation on the home front from the family. And the report wasn't considered urgent because those details were unknown. And so eventually when that face-to-face was able to happen and the Child Center was able to talk to him, that child did detail additional incidences of abuse that occurred after that time period when the family was asked to bring them in. And there was no way to ask for help. So this was during online classes. And that was because his abuser was actually monitoring him the whole time. And so I worked with the Child Center last summer with their prevention team specifically to figure out how do we enhance or create ways for children to report without maybe a parent or some other abuser in the home knowing, and also making sure that the prevention programming could still be provided to kids at home and virtual, and somewhat not sneaking, but putting in ways in there where you open up chat, or you open up, here's a form, entered information in privately, to just potentially put a red flag on a potential case or a child for follow-up purposes. And Youth in Need, then, they are an organization that provides counseling for a lot of the mental health issues. And they noted that clients really felt disconnected from peers and friends, and then again, created loneliness and sadness. They really just had that fear of missing out. Teacher, collaboration, teacher just discussions, routine. This led with some clients having sleep issues. A lot of family conflict was mentioned, and just more in arguments in the home front, people not getting along. So the individuals that they only were seeing on a regular basis, they were having a lot of conflict. So again, more isolation, and then that keeps up that road down to sadness, loneliness, frustration, and anger. So in summary here, the adjustment of staying at home from the Youth in Need perspective for that past 5 months from that data collection period, that really just wore on people in general and increased their need for social interactions. So I have 2 children. I have a high level introvert and a high level extrovert. And so we really approached how we worked and ensured there was some peer connection very differently for my children. My daughter, who is that extrovert, I tried to figure out if there were certain people we could put in that circle, because we have a smaller circle of people, spoke with some families so that there could be at least some interaction with some friends. And then also, I allowed for some additional ways for them to communicate with peers in a monitored way. With my son, that gaming environment with his friends, while maybe before COVID, I would have been more restrictive, as when I started to hear that he was still able to communicate with people his age, and hear him laugh on a regular basis, assuming that school was being handled, I would allow for that more. And so I really think just looking at your children, looking at their needs, responding to them differently based on how you're seeing them react, and really having open moments that you can have them talk. My favorite time is that evening hour. They're more likely to really kind of just share if I let them share. So we also asked these agencies at the time what modifications they were potentially going to make to service delivery to respond to, this COVID-19 pandemic. And I wanted to share these as well, because some of you, may have employed these in your service delivery, and others, there's just some great ideas here. And so briefly, I'm just going to go over them in that, Compass, it was shut down for a while, their school-based program. And so then they began producing video lessons for teachers and families to access. And they also noted that they would just continue to adjust to other online formats as the pandemic continued. With their Pinocchio program, they also converted to a virtual platform. Although there were some struggles with technology and adequate data packages and reliable internet, and yet as time progressed, some of those families were able to have, resolution with hotspots, or just other ways, where I know like a Youth in Need would go out there and meet them at, say, a particular area where there was internet services. So, the Chick-fil-A parking lot, something like that. Then for families that did engage, staff were able to provide, the regular check-ins regarding the entire family so that they could, connect them to those needed resources. And really staying connected to parents was what they focused on to maintain that support. With their home and community-based service, specifically partnership with families, again, went to that virtual platform. The telehealth component that came out of the pandemic is just huge. And I believe, that should and will be continued. Research that I've done for years, before COVID, on some of those barriers to getting mental and behavioral health services, telehealth resolved many of those issues. So let's continue that. And then they had connections, or I should say assessments for other just basic needs. I'm a huge fan of that Maslow hierarchy of needs. While it's somewhat of a flawed model, we need to make sure basic needs are provided before we attempt to resolve the mental health, because otherwise that kiddo is just going to keep going back. I need food. I need to feel safe. I need to make sure, I'm clothed, before they resolve some of those isolation and sadness and depression needs. Then their protocol here again just was the telehealth piece. So that was great. Within the school-based mental health specialist program, modifications were similar to what I stated before with the telehealth piece. And then they also just had more constant follow-up, including screening for the illness, education on safety precautions as it related to COVID, which was not a component of the program, but needed to be at this point. And then also giving them support on what to do if you believe you have been, diagnosed, or you think that you have it. What do you do next? And so they basically just stated they would continue to provide that telehealth component. The partnership with families through FACT is that collaborator with Compass as well. So they basically see the same families, but just do different services. So while they stopped services with face-to-face, they then leaned towards, Zoom, FaceTime, and other online platforms so they could provide those services. Nurses for newborns, they had to stop providing in-home face-to-face visits. So then their visits became telehealth. And then they also secured funding at the time, very early on, to purchase cell phones that were preloaded with Google Duo. So really thinking outside the box. And they gave families 3 months of unlimited time to provide for more virtual visits without that burden, that financial burden, or just accessibility burden falling on the families. So they could keep those phones if they kept all of their appointments for 3 months. So really neat, just outside the box. They were also contacted early on about accepting a Lincoln County referral for a baby who was born premature and needed weight check-in. So these are some of the unique cases that the agencies have to respond to, and just, again, think outside the box. So they weren't able to provide this for the family, in person. So instead they purchased the tools, the scales and instruction sheets for that family to do that. And then they basically eliminated the need for that family to have to come into that doctor office. And so beyond just the telehealth visits, they then leaned towards dropping supplies off, whereas otherwise that individual, or family would have had to come in to get some of these necessities. Presbyterian, their therapeutic mentoring program, still relied a lot on that teleconferencing component. And they said that, many of their families and clients were disengaged from their mentor, and they saw a lot of parents not responding to phone calls. So in a couple of cases involving, serious concern for the family's well-being, that the mentors would make unannounced visits to homes. And I know they aren't the only agency to have done that, is basically go out to the home site, maybe not necessarily in that home site, but out to that home site, because you can really just kind of, open up your eyes and have some more observation that's present when you're trying to figure out what's going on. And here they also handed out masks. So other protocols they put in place, they continued phone calls, letters, and drive-bys. They even thought about doing courier services for things like homework and other academic needs. They thought about recreational outlets. So they incorporated more physical activity into the open spaces and, under their umbrella. They also would provide, hands-on instruction for academic needs of those children. And these, again, all come from mentors. So the mentor really is able to respond to what's going on with that specific child. And then again, more in-school support, or support for that student through school, and helping those teachers and anyone, working with that student to help them resolve their emotional issues, meltdowns, dysregulation, etc. And so that was really a neat way. You see here all of the list, the laundry list of things that they thought of that responds to each of those potential needs. So St. Louis Counseling also transitioned to telehealth. Here again, you'll note that they remark, the changes in the number of appointments they had through the transition, through the COVID transition, and that protocol they put in place were more, again, telehealth capabilities for virtual and telephone, just basic telephone, especially in those cases where you don't have some of that internet capability on the home front. Then they also introduce a lot more safety protocols, things like just having masks, extra masks, hand sanitizer, and potentially even, those plastic partitions we saw. Similar kind of remark here for the modification for their outpatient psychiatric service. And crisis nursery actually still remained open 24/7 during that pandemic because they knew that the safety and risk issues that they normally respond to were just heightened. So they did enhance safety protocol, and they would do things like, pre-screening, restricting entry to the nursery for anyone other than the child, fever screening, phone-based intakes and discharges to minimize contact, and then immediately providing a change of clothes and bathing the child upon admission. And of course, keeping up with sanitizing protocol. Saints Joachim and Anne stopped doing face-to-face visits, but then implored Zoom and FaceTime and, just the use of phone and things like that. They also noticed that there may be other underlying health conditions or low immune systems among their families, and that many of them were really grateful that they could continue to, remain in the program, but ensure their safety at all times. And that was just the protocol they continued. So the Child Center Advocacy Services, they were deemed essential by the Missouri Department of Social Services. So forensic interviews and advocacy services were not interrupted, although because of that hotline component, maybe less were known at the time. But the entire time, the Child Center, just from my communication with them, they knew there was going to be a period once those kiddos went back into regular environments that mandated reporters were at, that it was just the reports were going to go through the roof potentially. And so they prepared for that, making sure they had the means and the capability to respond when that happened. So within this program, though, they screened for respiratory illness, took temperatures, things like that. Oh, I want to make a note of here too. They actually then alternated their teams through the summer of last year. So that could be another approach as well, especially when you're dealing with just that virus or any sickness that can take your team down. It's not just this period of time, just that they rotated their space and actually their work environment, 1 week on or 2 weeks on, and then alternated weeks when those individuals came to the office. So their prevention programming actually created online and virtual versions of the child abuse program. And actually I worked with them to develop, SurveyMonkey tools to gather information. Normally you get some of those partial disclosures within the classroom. And so how could you still potentially get those without a child, just openly saying it or typing it in the chat for everyone to see? So that was very important. And then showing them, working with the staff to be able to immediately pull up those findings if a disclosure was provided at that time. They also then reached out to the school districts to provide a refresher course on how to handle disclosures and to pick up just some of those red flags via, the internet. If you are a teacher out there and every time you were getting on virtual, the same student never opened up their camera, it would be potentially encouraged to reach out to that student to have a one-on-one and talk through that, because it could be any one of reasons, right? But a lot of them could relate to, emotional health, mental health, and potentially even child abuse and neglect that is being hidden. So they went through the time, their plan A and plan B, and we did, it morphed into the plan B, especially for those schools that were virtual or portions virtual. And then those schools that went in person, they utilized plan A. So Thrive also, transformed their program to Zoom and Google Classrooms. And then they just continue to strengthen and develop relationships and communication with their school districts to make sure that this program could continue to be provided. So Youth in Need then did offer telehealth, ensuring HIPAA, secured platforms. So that's one thing too to be aware of, is just protecting that medical information that comes from the child on those platforms, and that others can't identify them or jump on to like an open Zoom, right? They then continue to provide case management for some of those families to offer continued support. And then as restrictions began to loosen and the outside environment was pleasant, they would actually do outdoor therapy. So again, thinking outside the box, therapy can be provided in a variety of settings. So let's use the outdoors for that. And then just more and more here, just responding that they're going to continue to implement protocols to respond to the need and making sure they can provide that therapy and utilizing spaces outside the box. So really they looked at, blended model. Maybe this person needs a little virtual, a little phone, and they can also once a month go outside and meet them. I know in some cases, especially during that period of time where people were at home, Youth in Need staff would go out to the home and they would have that just safe space, but again, outdoors. Okay, so that was that first data period. And so now looking at then about 6-7 months later, we asked some additional questions of those agencies. And I did summarize this one. So in January 2021, we asked, so since the spring and with the reopening of schools and a lot of those extracurricular activities, resuming, would you consider that the mental health needs of your clients were stabilizing, improving, or are still managing growing mental health concerns? And then if growing, what do you attribute to those concerns? And so just in summary, again, this just 6-7 months after that other data collection period, we had continuing and growing mental health concerns, increased stress, lack of access to in-person supports at school, church, sports, and other activities. So huge continuation for a lot of kiddos. Report that families and parents are experiencing increased mental health concerns, increase in anxiety, depression, and suicidal ideation was brought up by a majority of the agencies. Parents also experiencing increased anxiety and depression, some due to unemployment, job loss, loss of income, and ability to provide for basic needs. And just some, the lack of support to resolve and respond to your students or your child's needs. By this period of time, then academic losses were setting in, especially among those students that were virtual at half or the whole year, and students regularly put in quarantine. And there was no rhyme or reason in some of the kiddos being put in quarantine in terms of the number of times. One kid could have the entire year escaped a quarantine, while another kid could have been quarantined 5, 6, 7 times. That was the struggle. And, I can think of periods last year where I'd see that email come and I'd think, oh, please, 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 I can't deal with that this week, right? And thankfully, a lot of the times it was just a, far away contact. But my daughter would come home and act like it was, something coming after her, a monster. Mom, I escaped today. It didn't reach me, kind of thing. She never got quarantined. My son was virtual all of first semester last year, went back in person in January, lasted 6 days and went on a 2-week quarantine. So very different experiences and response from mom. So then we see more relational difficulties with the family. And then of course that increase the family intervention component that a lot of these agencies, provide. Mental health concerns, financial issues, lack of resources again, virtual students struggling with consistently engaging in school, excuse me, and being negatively impacted by not having that structure and social supports. So just a lot of these things that every single person in the household dealt with. It's just not unique to the child that normally these agencies would, focus on. Many of them, like I said, focus on the family unit too, but it just really became more of a family crisis, a family mental health condition or concern. And then in the document that you can receive from me here, just send me an email, cynberry, Berry, 42 @msn.com. I've put it in this tool or as well, this document as well. You can have access to all of this information because I know a variety of you can use this for, many ways. So please reach out to me or the community council, the representatives for the community summit to get this information. And then you can see the full comments for there. Okay. So then we asked them what was their most concerning behavior or circumstance for kids and families in Lincoln County during this COVID time that potentially, that board or the system of care in Lincoln County needs to address or know about. The Child Center noticed just the increasing number of victimizations and repeat victimizations, great concern. And so that prevention piece right there, how do we arm a child with the tools? And when I say tools, the ability to get away, to avoid this, either the first time or on repeat situations. From Nurses for Newborns, it was just, that continued access and connectivity. There was, disruption there. For families, there was an increased need to meet social determinants, food, formula, those basic needs. And so they did a lot of those porch drops, which was really innovative. Not necessarily part of the original service delivery plan, but something that Lincoln County Resource Board said, yeah, we can support that so that the families continue to get services. St. Joachim and Ann noticed that their most concerning behavior was just that generalized high anxiety, tension in that home, especially related to a job loss. So that financial piece as well, very present and prevalent throughout this pandemic, and then just falling or failing grades. And that became kind of an ugly cycle. A student that, is normally A or B now is B or C or lower, and then increased anxiety of how is this going to impact me, moving forward, especially those high school kiddos that kind of think about that college piece or decided not to because of this. Just that volume of people. There was so much more, there were so many more individuals that needed support. And so they actually had to start a wait list. And then not only did the volume increase, but then that level. So the time, they need more time to get some of these things resolved. So that requires some modification to just your general service delivery plan. And so for a lot of, my school people out there or anybody that provides a service to youth, there may now be, whereas 4 visits may have, been the key before, it may now be 6 or 8 or something like that. So Compass Health noticed just that the added stress of constant change, and that then exacerbated mental health conditions already mentioned, more created financial hurdles. Many individuals, made a decision to leave employment when schools went virtual, and then just that lack of daycare piece as well for younger children. So even at January 2021, the fear of that unknown and what's next just kept happening. And as it, the pandemic worsened, some schools had to go back to virtual. Some individuals or companies had to close their doors. And yet, regardless of that, Compass Health Network wanted to make sure they were viewed as that beacon of hope. They were the ones that could help them. So, hey, keep coming to us. We are stable. We can provide you services and be a resource for you. Youth in Need just noticed that the most concerning behavior of youth are those that are choosing to receive virtual learning, but really aren't engaging, didn't know how to engage. They need to be part of that school learning in person to be successful, and just that home environment made it very difficult. So, some parents were giving their child that choice, but then not holding them accountable or not really making sure that they provided that structure. With my one child, there was a lot of structure that I needed to put in place and a lot of things that he didn't know about. Just, how to be an advocate with your teachers. Instead of mom having to always do the emailing, it now needs to be you if you've missed something or you didn't understand something. So a lot of those social supports for those kids provided by Youth in Need. Crisis Nursery just noted again the amplifying effect of stressors on the families. Those were being experienced before and now, continued, but just at a heightened level. Then again, those financial burdens, social isolation, and then all of these challenges led to increase in family violence. And we know the impact of those. So especially, this was for isolated families. Presbyterian Children's Home and Services, mentioned that a lot of these families that they serve are in poverty or in areas of poor limited internet. And so some of those things were broken, poorly maintained. It just was kind of an on and off type of experience. And that then, the pandemic increased the stressed home environment, more poor communication, more frustration, and then unmotivated children. Okay, keeping kids safe from a distance. This was really the most alarming thing that was noted by the Child Center. And so they had to work with many teachers and counselors to provide those programming. And some of those students that were virtual, then, you had other challenges. So they were going to continue to provide mandated reporter training as well, so that teachers and counselors could figure out ways to, notice red flags virtually. Or if a student disclosed virtually, what do you do? So that was a really great way for them to, come together, rely on each other, but make sure and maintain this service. And then Thrive just noted, that there was a lot of resilience during this unprecedented time. And here, I love this. Of course, they thank LCRB. I mean, the funding from Lincoln County to do a lot of these programs, and in St. Charles, CCRB as well. We wouldn't have these services had we not had Lincoln County Resource Board and the St. Charles Community and Children's Resource Board. So they did notice a lot more risky behaviors among students, sex, drug, alcohol, peer pressure, negative media, smoking, things like that. And those are what's addressed by their program. So a couple more questions that I want to make sure I present. And just, this was about caseloads returning to more traditional methods of care, or were you still doing, school and office based? And that, do you still have a number of consumers who are choosing telehealth and other alternative methods of care? So almost kind of like a point in time assessment here of what are the preferences of people as the pandemic continued. And so this particular section, I just wanted to highlight that, you can come here and read through each of these specifically to see how it impacted each of them and potentially gain some nuggets of information that may be, important to what you do. Maybe you're a provider for families and youth relating to these types of issues. And so you wanted to see, hey, were their experiences in January of this year similar to what we experienced? So I'm going to provide this to you, but just not read through these. And then in summary, I have part one for those school staff comments, perceptions over many periods of time. I believe it covers approximately an 18-month stretch. And this particular video was focused on the not-for-profit agency, the nonprofit agencies that are funded through Lincoln County Resource Board. And I actually have another data collection period from that group occurring in October. So I don't have that data yet. But when I do, I hope to provide that to the for the Community Summit's benefit. So you can see, where are we at now, about 9 months after this last period of time. So overall, the impact of COVID-19, I mean, this changed the landscape of mental health, service delivery, how we identify need, those clues, and definitely an increased demand on the family. We saw this increased child abuse and neglect, domestic violence, family disruption, family conflict. We saw the economic stress. It contributed to all sorts of families, any level this impacted, and an increase in families who are food and or housing insecure. Health scares, the fear piece, especially to family members. What if I get this? How will my body respond? I see that from just, family members that are nurses, talking to them that 5 patients would come in, you would make, a determination of how it might impact those 5 people. And they would just say, we would be wrong every time. You'd leave your shift and think patient, A was going to do well and patient B would probably not be there the next day. And these are real life stories from, my family members. And they'd come in the next day and the family member or that person that came in that was doing well was now on the ventilator and fighting for their life, and the other came through. So there was a lot of, lack of just information and how might this impact me. And then we did see this impact families. I know of relatives that have been affected by this long-term impact of COVID to their health, and then even in some cases, death. And we see those numbers still in September 2021. Isolation, lack of social interaction, that then over time, this really did lead to official diagnoses of depression, not just being generally sad, but depression and also anxiety, and then increased alcohol, increased drug use, relapse, some of those negative bad habit behaviors just not crept in and then just exploded in some of our families and youth. And then the academic challenges or delays. So in summary, our region has so many programs and services that are funded by LCRB and CCRB and are provided by our school districts to respond to these needs. If you don't know them, go to their websites, print that list. If you're a school counselor, if you're a school teacher, if you're just a parent listening to me today, find those lists, share that information with your kiddos. Last year, my daughter, who's young, had another student share some suicidal ideations with her. And so I sat down with her. I said, hey, I want to tell you about BHR, behavioral health response. And here's the number. This isn't just for your friend, but if you ever have something going on and you don't feel like coming to mom, but you can share this number, which is, an immediate way to get someone on the phone and help you, do that. We all have to do that part. We can't just rely on the nonprofit agencies that are funded by LCRB and CCRB to help our kids, especially, like I've said, this is impacting the general population. So as a parent, provide those tools. As a school district, put magnets on the back of the bathrooms or in different ways that you communicate to kids. Here's that number. Here's a resource. Here's where you can go. So here we know that these needs outweigh what is available. We need more services, and these agencies fund more and more. I should say CCRB and LCRB fund these more and more every year. So as a group, as a whole, we need to continue to work together to stay on top of these needs, and also developing a more comprehensive and long-lasting solution, including teaching our youth how to cope with these on a daily basis. So with that, I know a little long, I apologize, but I really hope that, for those of you who can just skim through those areas that maybe you don't want to have me focus on, but I wanted to make sure I covered all of these sources that I've received to share that story with you, and hopefully it'll help you with what you do. So again, thank you for listening to my presentation, part 1 and or part 2. And again, I'm Cynthia Berry. I am the founder and owner of Berry Organizational Leadership Development. I am a psychologist by trade, but I'm more of a community psychologist and research psychologist than your clinical type psychologist. My email, where you can reach me at, is cinberry42@msn.com. And again, I thank you for your time and have a great rest of your day.